Hi everyone, this is Dr. Swamy Haladi. I work as a global program manager for the mycotoxin risk management program within our feed safety program. In the last video, I was explaining about some of the challenges we see in the field in related to the mycotoxin diagnosis, mycotoxicosis diagnosis. And in this video, I would like to explain about what is the role of mycotoxin analysis in this, and is the mycotoxin analysis is good enough to have a complete picture of the mycotoxicosis. So I'm sure many of you know the word mycotoxicosis is commonly used in animals which are ingesting different levels of mycotoxins. Of course, if you ingest too much of mycotoxins, we call acute mycotoxicosis. If you ingest low levels of mycotoxins over a period of time, we call them as chronic mycotoxicosis. When this happens in the field, one of the most common method of diagnosis today is analyzing the feed for mycotoxins in the field. Sometimes some people analyze the raw materials as well, which I will address at a later stage, but let's stick to the analysis of the feed. And the next question is, okay, I analyzed the feed sample, I received the results back from the laboratory, I see a particular level of mycotoxins. Is that information good enough? Can you make a decision based on those, just the mycotoxin analysis in the feed? And if you ask me that question, probably my answer is no, because that is only giving feed information. And we know that there are a lot of challenges with mycotoxin analysis in terms of sampling. So for a holistic approach, I would call my farm manager, I would call my veterinarian, and probably I will also ask about my procurement manager. So ask him the question, where did he get the raw materials from? Did he get it from US? Did he get it from Europe or some parts of Asia or in Latin America? So I get the question, ask the question to the procurement manager, I get the information. Number two, I will talk to my veterinarian and see, is he seeing any challenges or observing any unwanted increase in the size of the liver or any kidney challenges. So ask them about, we call them a post-mortem lesions or findings. Then of course, I will talk to my farm manager and ask him, did you see any symptoms of mycotoxicosis? For example, in chicken, if there is a T2 problem, we see lesions in the oral cavity. So these are the kind of questions I would ask the raw material procurement person, the veterinarian in charge of the farm, and of course the farm manager who is looking into it, and then of course my laboratory person who is doing the mycotoxin analysis. Bringing all these people together and sitting and try to understand where the mycotoxin challenge might have come from. So this is what I would recommend to do rather than just looking at mycotoxin analysis in the feed. And I hope it's a useful tip for all of you.